Head injury is one of the most important emergency situation. The head injury may involve the scalp, skull, or even the brain. The scalp has a rich blood supply, so even a minor injury can lead to the profuse bleeding. And the scalp injury is simply managed by debridement and suturing. Like in this picture, the scalp injury is managed by simple suturing. The skull injury. Skull gets fractured due to the crush injuries or severe forces. And fracture of the skull is of two types. One is the linear fracture and one is the depressed fracture. The depressed fracture is more dangerous than the linear fracture because it leads to the intracranial hematomas. Sometimes there is a fracture of the base of the skull and this leads to the CSF rhinorrhea, means CSF flowing through the nose. This picture explains the fracture of the skull. On the left side here, this is the simple linear fracture. There is no any involvement of the internal structure and no hematoma formation. While in this picture, this is the depressed bone. This leads to the intracranial hematomas like extradural hematoma. And also the brain parenchyma is compressed due to the depressed bone. Physical signs of the skull fracture. Before this, concentrate on this picture that the cranial fossa is divided into the three areas. One is the anterior cranial fossa, one is the middle cranial fossa, and the third one is the posterior cranial fossa. Now, fracture of these fossas lead to the different signs. Like if the interior cranial fossa is fractured, this leads to the nasal bleeding, CSF rhinorrhea, and periorbital hematoma. Along with these signs, there is also injury to the cranial nerves from 1 to 6. Cranial nerve 1 to 6 are injured. If the middle cranial fossa is fractured, this leads to the bleeding from the ears and CSF otorrhea, means CSF flowing through the ears. And also there is a cranial nerve injuries, likely cranial nerve 7 and 8 become injured. When there is a fracture of the posterior cranial fossa, this leads to the bruising over the suboccipital region, and sometimes the bruises also appear on the mastoid region, and this is given a sign known as the battle sign. Now coming towards the brain injury, the brain injury may be divided into the primary. The brain injury may be primary or secondary, and the primary brain injury is due to the trauma, while secondary brain injury follows the initial injury, and it's not due to trauma, it's due to the other causes than the trauma that are discussed later in this case. The primary brain injury may be cope injury or counter cope injury. If the injury occurs at the site of impact, this is known as the cope injury, and if the injury occurs opposite to the site of impact, this is known as the counter cope injury. Like demonstration of this picture shows that the injury occurs at the frontal lobe due to the impact on the frontal lobe. This is known as the cope injury. While here in this picture, the impact occurs on the frontal lobe, but the injury occurs on the occipital lobe, occipital region. This is known as the counter-cope injury. The primary brain injuries of following types: diffuse axonal injury, cerebral contusion, and laceration. The most important is the diffuse axonal injury. Basically, this is the shearing of the gray-white interface. Shearing means separation of the gray and white interface where the gray and white matter of the brain meets. This leads to the brain atrophy. In this picture, like this one is the gray matter and this one is the white matter, and this showing here the sharing of the gray white interface. Coming toward the secondary brain injury, this often follows the primary injury and is due to hypoxia, number one, that is the lack of oxygen. Hypercapnia means increased carbon dioxide in the blood. Number three is the hypotension. The hypotension results in ischemia of the brain. And number four is the intracranial hemorrhage like extradural and subdural hematomas. And number five is the meningitis and epilepsy. So these are the causes of the secondary brain injury, and the secondary brain injury does not occur due to the trauma. Secondary brain injury is the most common cause of death in a hospitalized patient following the head injury. Clinical features of the brain injury are mostly due to the raised intracranial pressure. And when the intracranial pressure rises, this leads to the decreased perfusion of the blood, decreased perfusion of the brain. As according to the formula, the cerebral perfusion is equal to the blood pressure minus intracranial pressure. The resulting ischemia of the cardiopulmonary centers, which are located into the brainstem, results in reflex increase in systemic blood pressure and bradycardia. So the first sign of the raised intracranial pressure is the hypertension and bradycardia, and this phenomena is called Cushing reflex. Means the blood pressure is raised due to compensatory mechanism of the body, and there is the bradycardia. Other features are of intracerebral hemorrhage, which are already described into these extradural and subdural hematomas. Now coming towards the management, the general management is same, like you have to give the airway breathing circulation protocol, that is known as the ABCT protocol. Maintain the oxygen level, giving the keeping the patient on ventilator, passing the two large bore IV cannulas, catheter should be passed, CVP line should be maintained, NG should be passed, and start IV fluids. And first you have to clear the airways to make the airways intact, and then if the patient develops the seizure, you have to give the diazepam. And the specific management is actually reducing the intracranial pressure. This is by giving the state dose of the mannitol, then followed by the IV steroid like dexamethasone, and sometimes a calcium channel blocker like the nimodipine is also given, because usually after the hemorrhage the vasospasm occur as a compensatory mechanism to maintain the hemostasis. So this leads to the further damage by ischemia. So there is a ischemic infarction of the brain. So to prevent that ischemia, we give the calcium channel blockers to prevent the vasospasm. And the final and mainstay treatment is the surgical, that is the craniotomy and the evacuation of the hematomas.